I specialize in urogynecology and minimally invasive surgical options. So my patients mostly are those who have surgical diseases, sometimes managed medically as well. The biggest two categories of diseases that I see are what is called pelvic organ prolapse and incontinence. But I also see patients who have large fibroid tumors or some ovarian masses or severe endometriosis. With the advent of being able to do more and more surgery laparoscopically or robotically, which means being able to do surgeries through little incisions and not have to make bigger incisions, has really revolutionized this field. I find that I'm able to get them better, they get back to work in a much quicker time, get back to their families and household activities, and it's very rewarding. Incontinence and prolapse are things that a lot of people have not discussed with their friends, have not discussed with their doctors even, because it is very embarrassing. So first thing that I tell patients is that you're not alone. 50% of women over 65 have a problem associated with either prolapse or incontinence. It is such a normal function of life that when it doesn't work, it's very devastating. Having to lose urine or to not have control over your bowel movements is something that is very embarrassing, very distressing, and very difficult for people to discuss. So first thing, I have to earn their trust so that a person can talk about it without feeling embarrassed, feeling like they can talk about these problems and move somewhere and see the light at the end of the tunnel. So I like to empower my patients. I like to educate them on their disease and their pathology, educate them on normal physiology, and then provide them with multiple options. Some of the options include non-surgical options, and some of the options include surgical options. I have an expertise more so in being able to provide minimally invasive surgical options. And so then I discuss with them the surgical options that are available, and depending on a patient's other medical conditions, their ability to deal with surgery or not, then we as a team, the patient and myself, with other providers in the urogynecology team, we make a decision. And sometimes patients can try a non-surgical option for a while and then move on to the next option depending on how they do. People need to know what their problem is, what are their options, and what are they choosing and why. Our visit is mostly about learning about their disease process, educating them about it, providing them options, and then deciding what the next step would be. My name is Neena Agarwala. I'm subspecialized in urogynecology and minimally invasive pelvic surgery. I went to medical school at Penn State Milton S. Hershey Medical Center, and then I did internship at University of California, San Francisco. I went back and finished my residency at Penn State Geisinger Medical Center in OBGYN, and then I did a fellowship training in Tennessee in minimally invasive gynecological surgery with urogynecology. And since then, I have been practicing here in Omaha.